Hello, my name is Kevin Quishan, one of the resident faculty here at Spear Education, and welcome to another Lunch and Learn. Today I want to spend some time talking to you about adult orthodontics in your practice. You know, traditionally when we think about braces or orthodontics, we think about kids 7 or 8 years old whose permanent dentition is starting to come in, but there's some pretty severe crowding that we want to correct, or we want to create some space for the permanent dentition to be able to come in. Or we think about teenagers, high school students whose permanent dentition is in, but we want to finish dealing with the alignment, creating a nice smile and good function, hopefully that they'll have for the rest of their life. Adults, on the other hand, are very tentative to undergo orthodontic treatment. And, you know, it might be because the brackets or the braces interfere with their job. Kids don't have jobs, they don't care about that. And it might be because the brackets or the braces make them look too adolescent, or they're worried about that. You know, they already made it through that awkward part of their life, they don't want to go back to that again. And it might be the cost of the braces. You know, kids don't care how much it costs, they have no desire to find out how much it costs. Adults care about that. Or it might be because of the length of time that it takes to do the treatment. Again, kids don't care how long the treatment takes. If they did, they'd probably wear their elastics a little bit more. Adults are very worried about how long the treatment's going to take. So today we're going to talk about 4 specific areas that are prominent in every practice. The first is going to be how straight teeth are much easier to clean and maintain. We're also going to talk about how putting teeth back where they belong before we do the dentistry, so pre-restorative orthodontics, can have a great impact on our practice. We're going to talk about function a little bit and how just a slight tweak of teeth can have a great positive impact on long-term function. And finally, how braces or orthodontic treatment can help us do more conservative dentistry, which is always one of our goals, and it would be one of our goals if we were the patient as well. The first topic that I mentioned is probably the one that is least talked about in everybody's practice, and is probably the one that, ironically, that should be talked about the most. And that is that teeth are straight are easier to keep clean. When you look at the photo on the left, again, you can imagine the bristles of the toothbrush trying to get in the little nooks and crannies, or the floss getting caught down in between there, let alone what's happening with the bone and the gums down below there. And then consider back teeth, where just a slight rotation or a tip of a tooth can create a contact that's difficult to floss, or even worse, an open contact that now is a food trap, which creates other periodontal issues. So, and again, ask your hygienist, which of these 2 mouths would he or she rather clean, the one on the left or the one on the right? I would say that the final result is probably better with the one on the right, and we all feel better about the long-term care of those teeth. So again, this is a conversation that doesn't happen very often, and if we ended today's presentation right here, we would, and really focused on this for the next couple of weeks, we'd probably help a lot of patients in our practice make some pretty healthy choices and incorporate adult orthodontics into our practice. So let's move on to the second topic that I want to bring to your attention today, and that is moving teeth back where they were before they were worn down to restore them. A specific example in most every practice are teeth that have been worn down over time, so now they're chipped and worn looking, and a patient is interested in restoring those. They're tired of looking at the chipped and worn teeth. Oftentimes they're worn all the way down to the dentin, as you can see in this photo right here. So again, that has to be at least 1.5 millimeters, if not over 2.5 millimeters of enamel that is worn away. And so that's really what we need to restore back. So when you look at this particular patient, and you can see that actually the tooth display at rest is pretty adequate. And if we were going to add 2 millimeters, it would actually look a little bit too long. We might be able to add, 0.5 millimeter, maybe 1 millimeter at the most, but that's about it, not the 2.5 millimeters that have been destroyed or worn away. And again, if we look at her full smile, same thing. There's not enough space for 2 millimeters of any restorative material. The edges would be below her lip and the teeth would look too long. So if we pull the lips back out of the way, we get a better idea of what has happened here. And you can certainly see the irregularities of the incisal edges, but what I want to draw your attention to right now is the free gingival margin, the height of the free gingival margin of the centrals compared to the laterals. They're at about the same height, right? And so you can imagine that's what happened is the edges have worn away and then the tooth has dropped down. And the edges wore away and the tooth dropped down, and it brought the gums and bone with it. And so to have proper height to width ratio and create space, what we need to do is take those 2 centrals specifically, move them back up to where they were before they wore, and obviously now we've got our good 2 millimeters of space to restore what was worn away in the first place. So again, orthodontic treatment here would be very beneficial to help us restore the teeth back. A great example of that is this case here, where again the teeth have been worn away and they've dropped in several different patterns, including lower teeth that have super erupted up. And to properly restore these teeth, orthodontic treatment was done first, and the final result that you see here are some teeth with the free gingival margins that look great. Height to width ratios are very adequate. The teeth are lined up, and it has had a dramatic positive impact on function as well. Speaking of function, that's the third topic that I'd like to bring to your attention today, and that orthodontic treatment can help us with, obviously. But what I want to talk to you about is, ideally, we'd love it if all of our patients, when we bit together, had all of our back teeth touching evenly and simultaneously, and our front teeth guided or discluded our back teeth, right? Immediate posterior disclusion. And again, if we think about a back tooth that is tipped or rotated or canted and is really now an excursive interference, or it's a squeezer that's acting as a guider, that's when oftentimes we see cusp tips that are broken, fracture teeth, or again, that toothache that we can't really figure out. So just by doing slight tweaking, orthodontic tweaking of teeth, and not 2 years of orthodontic treatment, but just little tweaks here and there, we can have a real positive, profound impact on the long-term function for our patients and the predictability of the dentistry we would do for them after that. The fourth and final topic that I want to talk with you about today is the impact that orthodontics can have to create an environment for conservative dentistry for us. The patient you see here has obvious anterior crowding, wear of the incisal edges, similar to what we talked about earlier, and she's also interested in improving the shade of her teeth. So you would think, perfect, obviously let's line those teeth up orthodontically, putting the edges back where they were, like we talked about earlier, so that we could properly restore them, line them up for conservative dentistry, and do the veneers. Sadly, she was very opposed to dentistry. A lot of it has to do with her work schedule and travel schedule, and she asked me, what can we do without orthodontic treatment? So I mounted some models, put the edges where they belong, as we've discussed earlier, in her face, brought the incisal edges where they belong for proper function, which we just talked about, and then I took that model and sent it to my ceramist and said, hey, keep the edges where they belong, keep the function where it is, and make the teeth look good for me with proper height to width ratio. Basically what we're doing here is visualizing the end before we begin. The dilemma, however, is that the first thing I had to do on the day that we prepared the teeth was to do the orthodontics by removing enamel, at least on the front side. So I already had to remove a whole lot of enamel to create the nice arch form that braces couldn't do. I then had to prep back even farther using a reduction guide to make sure I created enough space for the restorative material, and the end result then was certainly a nice arch form, but really aggressive preparations that didn't leave a lot of enamel left. And with the lack of enamel, we now have a weaker bond, which jeopardizes the long-term success of these restorations. So again, you can see if we would have done orthodontic treatment first, the restorations would be far less aggressive and have a much better long-term outcome. An example that really brings everything together that we've talked about today is this patient here, who is interested in improving her aesthetic outcome as well as her function. But what you can see is the midline is off a little bit. There's inadequate spacing for the laterals or lack of symmetry. So the first thing we did is put braces on to improve the midline, get the free gingival margins about where we wanted, and also create spacing for better symmetry for the laterals. Finishing up here with the A-chain, you can really start to see things coming together. And the final result was, again, it's not perfect because the patient was already slightly compromised, but certainly we have free gingival margins that are where they belong. The height to width ratios are really great. The restorations were done very conservatively, and the function is phenomenal. So really, by doing orthodontics, we really hit everything we've talked about today. So to summarize, why orthodontics in your practice? Well, the four things we talked about today are first and probably foremost, as we said, that straight teeth are easier for both the patients and the hygienist to maintain. And if we're going to restore edges, it's much easier to put the teeth back where they were before we restored them so that we have space to put back the tooth that was worn away. The third thing we talked about is that just little tweaks, orthodontic tweaks, can have a really great impact on long-term function and predictability for all the rest of our dentistry. And finally, orthodontics really helps create an environment for us to do more conservative dentistry for our patients, which is always one of our main goals in dentistry. So I hope you will use the discussion and implementation guidelines. I hope they're useful for you. I hope today was useful for you, and I'll see you at the next Lunch and Learn. Have a great day.